Ovarian germ cell tumors are derived from the primordial germ cells of the ovary. These pluripotent cells migrate to the genital ridge early in the developing embryo, where they undergo meiosis to become oocytes and spermatozoa. So, since we're talking about the eggs and the seeds, and the birds and the bees and whatnot, when you hear germ cell, I want you to think of germinating seed. We've placed it on the counter here to remind you that germ cell tumors, of which there are numerous types, will be depicted on the right side of the scene. By the way, since these primordial germ cells are migrating in the early embryo, incomplete or aberrant migration can lead to germ cell tumors in other areas of the body along the midline. Check out the mediastinal mass video for more info on extragonadal germ cell tumors. For now, we'll stick to the ovary. Germ cell ovarian tumors account for 15 to 20% of all ovarian tumors, and, as you'd expect, are pretty similar to germ cell tumors of the testicle. The three types of germ cell tumors we'll be talking about are cystic teratomas, dysgerminomas, and yolk sac tumors. Let's start with the most startling one, the cystic teratoma. Cystic teratomas are the most common benign germ cell tumor. That's right. We're not talking about cancer quite yet, though we will be very soon, believe me. Cystic teratomas most commonly present between age 10 to 30. And whenever I hear the word teratoma, I think of a terrarium, with its eclectic mix of plant and animal life. And what is that? A couple of molars, maybe? Well, you see how the dirt at the bottom forms 3 layers? Cystic teratomas contain cells from 3 different germ cell layers: mesodermal tissue, such as muscle, and endodermal tissue, such as thyroid and other glands. The most prominent and pretty unsettling component is the ectodermal tissue, which is why you often see hair, sebaceous glands, and teeth in these tumors. On imaging, bright spots of calcification light up from teeth and bone, hence the bright spot on the floor caused by the terrarium as it magnifies the sun. And if that wasn't enough, these tumors smell pretty funky when you cut them open, thanks to all that sebaceous tissue. So just don't disturb the terrarium, okay? Cystic teratomas are frequently asymptomatic, presenting as a painless adnexal mass on routine exam. But, just like other ovarian tumors, if they grow large enough, they become a risk factor for ovarian torsion. Just look at that twisted cord holding up the terrarium. Makes me uncomfortable just looking at it. One especially intriguing type of cystic teratoma is the Struma ovarii, which is represented by this Struma ovarii mushroom terrarium. These tumors contain functioning thyroid tissue that will secrete thyroid hormone. What? This means they can cause hyperthyroidism despite a structurally and functionally normal thyroid gland. What? Check out the garden gnome in there sporting a recurring sketchy symbol for hyperthyroidism, a big red thyroid bow tie. On histology, you should see a bunch of thyroid follicles. So we've colored the shrooms to kind of look like a collection of follicles filled with that eosinophilic celluloid material. What other whimsical shroom secrets are in store for us? No magic. Radioactive iodine-123 is often used for diagnosis. Kind of like how a hormone-secreting thyroid nodule will show elevated uptake of I-123. If you see uptake of I-123 in the ovaries, you've got Struma ovarii, my friend. Fortunately, the vast majority of cystic teratomas are mature, which means they're benign. Less than 1% are immature teratomas, which are malignant. These contain less well-differentiated tissues, kind of like the amorphous rocks in the smaller terrarium here. No layers here. You know, this is what happens when you don't set up a terrarium correctly. These cancer crabs escaping from the immature terrarium represent the malignant potential of immature teratomas. Let's now move on to the most common malignant germ cell ovarian tumor, dysgerminomas. And when I say dysgerminoma, I want you to think of the dysgerminator dishwasher here, that dysgerms your dishes, if you will. Dysgerminomas are the counterpart of testicular seminomas in males. In fact, the two look identical under the microscope. Did someone say Seaman? The heroic master of the sea? And the seaman? Okay, seriously, you guys, who put the action figure in the dishwasher? Unlike seminomas, which tend to affect males in early adulthood, dysgerminomas occur most commonly in adolescent girls. In fact, dysgerminomas are the most common ovarian cancer in children. In these patients, look out for a characteristic increase in serum beta-HCG and LDH. Beta-HCG, remember, is the hormone normally produced by the placenta to maintain the corpus luteum. Beta-HCG, then, is like an overworked and underpaid beta-HCG babysitter, responsible for tending to that corpus luteum, represented here by a colicky baby dressed as our recurring symbol for that yellow corpus luteum, a yellow sunflower. Aw, calm down there, little luteal baby. No, wait, don't pour that. That's not... Looks like in her below minimum wage days, she grabbed the dehydrated milk for the baby's formula instead of the detergent. Dehydrated milk is our recurring sketchy symbol for lactate dehydrogenase, or LDH. All right, so we can measure beta-HCG and LDH in the serum. What other clues can we look out for? Well, because dysgerminomas are malignant tumors, they tend to grow fast. So any sign of a rapidly growing adnexonal mass or cyst should raise your suspicion for a dysgerminoma. And remember that twisty terrarium on the right. Big, rapidly growing masses can cause torsion as well, so watch out. On histology, dysgerminomas are comprised of fried egg cells, which just means that they have large central nuclei surrounded by a bunch of clear cytoplasm. And they go great with hash browns. Speaking of eggs, yolk sac tumors, also called endodermal sinus tumors, are the last type of germ cell ovarian tumor we'll cover in this sketch. Just look at Brenda over here, who forgot that egg dyeing is all about finesse. Getting a little yolky there. Amateur. Like the other germ cell ovarian tumors, these tend to occur in young girls and young adult women. And similar to dysgerminomas, yolk sac tumors can be malignant and have a male analog, also named the yolk sac tumor. The classic tumor marker associated with yolk sac tumors is serum alpha-fetoprotein, abbreviated AFP, highlighted by the egg carton advertising Alf's fresh produce. Because yolk sac tumors are malignant, they tend to grow fast and can get big, which means, yet again, an increased risk for ovarian torsion. On histology, yolk sac tumors contain Schiller-Duval bodies, represented by the Schiller egg chiller. Schiller-Duval bodies are papillary structures with a central vessel. They actually kind of look like glomeruli, oddly enough. On histology, you'll see these strange-looking spots, an outer purplish cellular layer surrounding a central blood vessel. That's it for germ cell tumors. Time to discuss the last major type of ovarian tumor, sex cord stromal tumors. Sex cord stromal tumors are derived from, you guessed it, sex cord tissue and gonadal stroma. Sex cord and stromal tumors will be placed on the left side of the room, under these cords holding up the Easter decorations. In females, the sex cords give rise to granulosa cells, while the stromal cells consist of theca cells as well as the mesenchymal cells that fill up the space between the follicles. One weird phenomenon that you'll see with sex cord stromal tumors is that they're not sex-specific. Unlike epithelial and germ cell ovarian tumors, many sex cord stromal tumors can occur in both males and females. So you'll see a few of these pop up in our testicular cancer videos as well. In general, sex cord stromal tumors are quite rare, accounting for only 5% of ovarian tumors. The majority of these tumors are benign, but once again, benign does not equal harmless. Let's start with the thicoma fibroma. While the two can be separate tumors, thicomas, consisting of theca cells, you know those cells that surround the outside of the follicle? And fibromas consisting of stromal fibrocytes. They're lumped into one category because these tumors tend to contain a mix of both cell types. In this scene, they're represented by a comb struggling to get through some thick fibers of hair. That's theca fibroma. Thicomas and fibromas are benign tumors and typically present in perimenopausal women. Ovarian fibromas are famous because they're associated with Meg syndrome. My eggs. No. My eggs. Mix. Meg syndrome consists of the classic triad of ascites, ovarian tumor, and a pleural effusion. Ascites is represented, as always, by a dilated inner tube around the abdomen, keeping the baby afloat during bath time. For the pleural effusion, we've brought back that puffy pleural pirate shirt, getting soaked with bathwater. Don't worry, the ascites and pleural effusion will resolve after removal of the tumor. Theca cells have abundant lipid-filled cytoplasm, leading to the tumor appearing yellow on gross pathology. The baby's clump of yellow eggs evokes the image of a yellow mass of cells. Next up, we have granulosa theca tumors. These are tumors that arise from both the granulosa cells, those cells that surround the oocyte in the follicle, as well as theca cells, which surround the granulosa cells. Granulosa theca tumors can occur at any age, but peak presentation is the perimenopausal period. Granulosa theca tumors are important because they produce estrogen, which means you can expect to see many of the symptoms associated with estrogen excess. And if you take a close look at our granulosa cell granny over here, you'll notice that her jewelry incorporates a recurring female estrogen symbol. Excess estrogen production can cause precocious puberty in young girls, as depicted by this precocious young girl here, who's acting way more mature than her age. She's got some kind of egg dye face makeup thing going on. Already has a long-distance boyfriend and everything. Hey, you. Is that thing even plugged in? Later, the excess estrogen production can present as abnormal uterine bleeding in women of reproductive age, and even postmenopausal bleeding in older women, hence the spots of red dye staining the pants of the postmenopausal granny. Remember, unopposed estrogen also increases the risk of endometrial hyperplasia and cancer. Think back to the uterine garden sketch, when excess estrogen fertilizer was causing some serious endometrial overgrowth. Interestingly, granulosa theca tumors have a pretty specific tumor marker, inhibin, a hormone normally secreted by granulosa cells that inhibits FSH secretion in the pituitary, forming a nice little negative feedback loop. That's why the granulosa granny is wagging her finger, inhibiting, if you will, the weirdly precocious phone call going on over there. Elevated levels of inhibin, especially in someone who's not pregnant, should raise your suspicion for granulosa theca tumor. I mentioned pregnancy because the other clinical use of inhibin is in the prenatal quad screen for Down syndrome. On histology, granulosa theca tumors will look like, granulosa and theca cells. The cuboidal granulosa cells typically form rosette-like structures known as Call-Exner bodies. Hey, Exner. Nothing. No, you hang up. No, you. In the center of the rosette, look for that pink eosinophilic spot. In fact, the rosettes of cuboidal cells kind of look like the rotary dial on that telephone down there. Instead of round holes, we drew square holes to remind you that the question stem will mention cuboidal cells specifically. Also, the cells are usually described as having coffee bean nuclei. Look, she's even precociously developed a coffee addiction. So young. Theca cells, as previously mentioned, are full of lipids, causing the tumor to appear yellow on gross pathology. So let's draw in another pile of those yellow eggs, collecting on the floor there. Granulosa theca cell tumors are technically malignant tumors, but have pretty indolent growth as far as malignant cancers are concerned, and, as such, are associated with favorable survival rates. Remember when I said that sex cord stromal tumors can occur in males and females? Well, the Sertoli-Leydig tumor is the classic example of that phenomenon in a female. Sertoli and Leydig cells are normally only found in the testes, and yet here we are, dying some Leydig ladybug eggs. Functionally, they're essentially the polar opposite of granulosa theca tumors. They produce androgens, causing patients to present with symptoms of androgen excess, hirsutism, clitoromegaly, and voice changes. Hirsutism is represented here by the black paint that's found its way onto this girl's face like a little mustache. We've also emphasized androgen overproduction specifically with the male symbol incorporated into this egg-holding contraption thingy. While Sertoli-Leydig tumors can present at any age, they tend to occur in young adults. They can be benign or malignant, and prognosis depends on their degree of differentiation. On histology, Sertoli-Leydig cell tumors appear as tubular structures lined by round Sertoli cells and surrounded by a fibrous stroma. Just think of these tubes used to hold up the ladybug eggs as they dry. If you've watched our testicular tumor video, You'll notice that this is exactly what we said back then. Yep, Sertoli Leydig cell tumors look identical in males and females. Well, there you have it. To sum it all up, we've got germ cell tumors on the right and sex cord stromal tumors on the left. The most common germ cell tumors are those cystic teratoma terrariums. These are usually benign, contain cells from 3 germ layers, and can cause ovarian torsion. Struma ovarii is a teratoma subtype that contains functioning thyroid tissue. So it causes hyperthyroidism and will take up radioactive iodine. Immature teratomas are malignant, hence the hermit cancer crabs, and contain poorly differentiated tissue. Dysgerminomas are malignant, the counterpart of testicular seminomas in males, and look like fried egg cells. Tumor markers to look for are the beta-HCG babysitter and LDH dehydrated milk. Yolk sac tumors, also called endodermal sinus tumors, are malignant and contain Schiller-Duval bodies. The tumor marker here is AFP. Over on the sex cord stromal side, thecoma fibromas are benign tumors that cause MEG syndrome. Ascites in pleural effusion, in other words. MEGs. No. MEGs. Granulosa theca tumors are usually low-grade malignant tumors that produce estrogen, causing precocious puberty, abnormal uterine bleeding, and postmenopausal bleeding. On histology, look for Cole-Exner bodies. The tumor marker to look for is inhibin, embodied by that finger wag rebuke. And lastly, the ladybugs represent Sertoli Leydig tumors, which can be benign or malignant, and produce testosterone, causing hirsutism, clitoromegaly, and voice changes. Histology shows tubules. No, you hang up. And that's it for germ cell and sex cord stromal ovarian tumors.
Okay.
Be sure to check out our video on epithelial ovarian tumors, if you haven't already, to get the full lowdown on ovarian tumors.
Yeah, I'm still here. No, stop. No, you stop.